Well, we've said already that health issues sometimes aren't as obvious as safety-related ones. How much dust is too much dust? Is that area too noisy? What does that actually mean? We don't identify these health effects for many years until it's too late. So how do we actually know when there's an issue? And it's all about identifying and managing the risk. So for occupational health-related issues, moving away from treatment, patching people up once they become ill, actually focus on managing the risk. And managing those risks, once you've identified them, is no different to managing safety-related risks. Identification, anticipation, they may be troublesome, but actually managing the risks, there's no need to treat them any differently. Just because it's a topic that you may not be familiar with or comfortable with, doesn't mean that with the right competent advice and guidance, the right support within your business, you can actually achieve that. And what I'm just trying to show on this slide here, on the picture, is really the cause and effect. Identifying that exposure to an occupational health issue can lead directly to an occupational ill health disease. So in this case, things like cement causing dermatitis or exposure to silica dust causing silicosis. It's about breaking that chain. It doesn't need to be highly technical, medical, scientific, health-related information that you need. Just knowing simply what can cause occupational health issues and how to minimize exposure or prevent the risk is all you need to do, making sure that you are able to break that chain. Now, the strategy that we actually used on the Olympic Park has now been used and adopted by many, many multinational corporations, not just in the UK, but globally. And that's what we call the 3W strategy, looking at the worker, the workplace, and well-being, with all three playing a pivotal role in how we understand occupational health. So the workplace takes the center of that. We focus primarily on managing the impact of work on people's health. We do that by anticipating, identifying, recognizing the risks, and then managing them. That's usually done through occupational hygienist work, much like myself, with prevention programs. Understanding where our risks are and mitigating those. Alongside that, we have the worker. Assessing how the health of the worker will impact on their ability to do the work. So we're not only looking about how the work impacts on the person, but how the person impacts on the work. Can that work be achieved safely, or do we need to make adjustments for that person? And then finally, well-being. Using well-being and promoting well-being within the workplace, so that we're not just being healthy while we work, but we're making these healthy choices outside of work as well. Now, none of these three pillars will stand up on its own. If you only use well-being initiatives in the workplace, it won't work. Think about it for a minute. If you're asking people to eat healthily or cut down on their drinking or smoking, yet still exposing them to risks in the workplace, how much credence does that message have? Has very little impact. But if you can show that you are committed to improving their health by minimizing their work-related risks, that well-being program will have much more of an impact. Workers will start to understand that it's not just about compliance and legislation, it's actually giving a damn about them and their health.